is Jocelyn. Can I record you for my assessment class today? Perfect. I'm going to wash my hands with soap and water. Can you tell me your first and last name?
Miguel Esparra.
Okay, when's your birthday?
July 5th, 1996.
Perfect. Does anybody in your family have any history of joint or muscle disease?
My grandma has osteoarthritis and my mom has slight scoliosis.
Okay, good to know. What about you?
I just get like slight pain when I play sports and stuff like that.
Okay, perfect. I'm first going to start off by assessing your temporomandibular joint. So I'm going to take a feel right here. If you can put your chin out and in and side to side. I don't hear any clicking. I don't feel any masses, no redness. Does that hurt at all? Perfect. Now if you want to shift a little bit to the side there, I'm going to check your neck. All right, put your chin to your, yep, exactly. I'm going to feel straight up to C7. All right, and if you can turn back around. If you can move your neck from side to side, up and down. Perfect. And now push against my hands, other side. Perfect. The next thing I'm going to do is I'm going to check your shoulders. I'm going to feel them first. Not tender, no masses. Raise your shoulders up and down. Perfect. And now I'm going to move down to your elbow area. I'm going to feel your elbows. Okay. And if you can bend and then down, rotate your wrist area. Perfect. And now if you can, I'm going to provide some pressure, okay? Perfect. All right. And then now your hands, if you can put them out like this, put your fingers down, up, your wrists up, your wrists down. Perfect. I'm going to feel your hands and your wrist area. Good. All right, and if you can turn your hands again, and if you can give me some resistance, awesome. The next thing, if you can stand up, I'm going to feel your hip area. I'm going to palpate. Doesn't seem like that causes any pain. So we're just going to do one leg. So if you can show me some range of motion, hip out. And then if you can rotate your hip for me, perfect. Awesome. And then you can take a seat again. I'm going to check your knees. I'm going to palpate your knees here. No pain. Do you ever have any problems with your knees? I know you said they hurt a little bit sometimes.
Just after, like I said, when I play sports, but it doesn't really last longer than like 2 days or something like that.
Perfect. Okay. Now if you can extend your leg, perfect, and then go back again in a normal position, perfect. And if you can stand, and if you can also again extend your leg all the way out as far as you can, and then fold it back, and then all the way back if you can. Perfect. Awesome. All right, and I'm going to go down to your feet. So if you sit back down again for me, I'm going to palpate. Perfect. All right, and if you can extend your toes upward, perfect. And now downward, perfect. Good strength there. And the last thing I'm going to check is your back. So if you can stand up and turn around, I'm going to feel your back here. Just follow the curvature of the spine. It's nice and straight, not tender. And now I'm going to shift you this way like this. And if you can bend over and touch your toes, perfect. You do have a C shape in that spine, which is what we want to see. All right, if you want to go back up to standing position, put your hands on your hips. And if you can rotate side to side, perfect. That's great. Thank you so much for letting me do my assessment on you today.